Hey everybody, Dr. Barron here with virtualheadachespecialist.com, where I blog about everything and anything you want to know about migraine and headache disorders. So I want to talk about a migraine event today and what it is that you are feeling when you are debilitated in bed, throwing up, wanting to be in the dark, quiet room. You know the misery. So it's an electrical event in the brain. And think of it like this: an electrical switch turns on in the brainstem. This electrical switch may be triggered by a variety of things. It can be hormonal triggers, it can be weather changes, barometric pressure changes, certain foods, not sleeping enough. There's all kinds of triggers out there. But keep in mind, there doesn't have to be a trigger. Migraine can just happen without any trigger at all. And so this electrical switch turns on from whatever did it, and that then turns on the trigeminal nerves. Trigeminal nerves are these nerves that come out of the brainstem. They innervate throughout the brain, inside of the skull, the face, sinuses, TMJ areas. And so you may get pain in all those areas with a migraine, which is very common. But when the trigeminal nerves get turned on, they release a variety of inflammatory proteins. And one of these is called CGRP, for example, which a lot of the newer medications are targeting. And so this protein and these inflammatory proteins are released, they diffuse throughout the brain, and they bind to their receptors. And there are three things that happen that really cause the migraine attack at this point. One, there is dilation of the blood vessels in the brain. This dilation itself doesn't actually cause the pain, but what happens is that the little trigeminal nerve fibers that are innervating and monitoring those little arteries are activated, and something is telling them there's something happening down here and it's probably not good. Those signals go to the brainstem. Brainstem says, hey, I agree, this is probably not a good thing. So then more inflammatory proteins are released, and essentially you are pouring gas on the fire. The migraine gets way more severe. Second thing that happens is that you get this very inflammatory response. We call this a sterile neurogenic inflammation. And it's almost like meningitis minus the infection, if I think it like that. Patients don't want to move around their head. They want to be still in bed, those kind of things, because it's a very inflammatory process. The third thing that happens with these inflammatory proteins is that they turn the volume up. They magnify the signaling of pain through the trigeminal nerves into the brainstem and into the cortex of the brain, which is the outer layer where the pain is recognized. And so the key is that you want to abort this process as quick as you can in the attack. The sooner the better. The longer the attack goes, the less you're going to be able to break it effectively. And then if you keep letting it go, you're going to get into these stages where your hair hurts, you don't want to touch or comb it, and that's called allodynia or central sensitization. So the key is to block it early, prevent all of this process, and hopefully maintain, restore normal function within an hour to two of the attack starting. If those things are not happening with your doctor, you guys need to have a conversation about what to move to make it happen. All right, take care. Have a good one.